And face masks will no longer be legally required and distancing rules will be scrapped at the final stage of England's COVID lockdown roadmap. This is coming from UK Prime Minister Boris Johnson. He confirmed the rule of 6 inside private homes will be removed and work-from-home guidance abolished as 16 months of on-off restrictions on daily life end. Now, Scotland, Wales and Northern Ireland are in charge of their own coronavirus rules. The Scottish Government has said it may continue to require masks in certain settings even after 9th of August, when it is hoped the final curbs will end. Now, ahead of a review on the 15th of July in Wales, ministers said people would need to learn to live with COVID. Meanwhile, rules in Northern Ireland have just eased with another review due on July the 8th. Well, Dr. Deji Olaleye is the Specialty Registrar Intensive Care Medicine. He joins us now from the United Kingdom. Thank you for joining us on the program.
Thank you, Millicent.
All right, Doctor. I mean, in the face of rapidly rising cases driven by new, more infectious Delta variants, what do you make of UK's 5-point plan to full easing?
Well, you are right in that there are rising cases, and as we look to lifting those restrictions, as you described, I haven't quite put my finger on it. It's a bit of I have a sort of mixed reaction to it in terms of, I think that we've vaccinated more than half the population, with 45 million people at least received the first dose. And if not now, then when? So that is there. However, with the lifting of the masks and social distancing regulations in view, that's the bit I'm quite skeptical about. I think that we do not necessarily have to lift those. I think it will be better if we maintain them at least for a while, although the Prime Minister said they're leaving it to individual discretions. So that's my view of it. I think it's mixed for me. I think sooner rather than later, it will be best we took advantage of our vaccination and our testing regimes. And at the same time, I think we should not just lift everything.
With winter coming, I mean, what is the flu season like? And you know, there are certain fears when it comes to that. What role will it play under the COVID-19 pandemic?
I think over the years, winter after winter, we've come to accept that there is what we call the flu season, and I think that's because the cold weather probably drives the transmission of respiratory viruses. So I think it is reasonable to expect that over the course of the winter, the number of COVID cases and possibly hospitalizations will go up, which makes it more informative that if we lift restrictions in the summer, we would have a sort of test drive to see how the cases would rise and how we manage any potential hospitalizations. And in addition, we have the vaccine. Some steps are being taken in that we expect that people over a certain age would have booster vaccines before the flu season is expected to rise. Over the last year, we had a reduction in number of influenza, that is flu, apparently because of the steps that were in place to limit COVID as well. They are both respiratory viruses. So I think all these together would inform how we would go into this year's flu season.
What's your take on face masks? Do you think that they should be abolished?
Yeah, I gave a snippet of that earlier. I don't think they should be abolished just yet. I think the evidence is sound that face masks protect and limit the spread of infection. And as long as some people, maybe even a lot of people, will still be infected by whatever variant of COVID is spreading, I think face masks should still be put in place, especially in public places, on public transport, in places in particular where there's a high risk of transmission.
My final question will be human behavior. I mean, that is really key, especially with regards to the MPIs and, you know, even if the variants come and the mutations, what would you expect from, you know, everyone living, even around you as well, also your workplace, as to keeping safe while managing, you know, this pandemic?
I think we've come a long way. It's about 18 months now, and over this period, there's been a lot of behavioral modification. I can say safely that people have changed in the way they don't hug, they avoid contact. There's a lot of social distancing is maintained. As we go into this phase of the nation, I think that people will be sensible. I think people will be sensible. There's less skepticism about COVID, about whether it exists or not. People understand that they have to protect themselves, they have to wash their hands, and I think people would comply. I think the lessons of the last 18 months have been well received, and I think they won't be so easy to shake off.
All right. Thank you so much, Dr. Deji Olale, a Specialty Registrar, Intensive Care Medicine. Thank you for that update. Thanks a lot.
You're welcome. Bye-bye.